I've been working on getting my teenage daughter to wear a sports bra. She will only put it on over her t-shirt. What would be the next step to get her to wear it under her shirt? It may be a sensory issue. She doesn't like the feeling of it next to her skin. It's a loose-fitting soft bra. Thanks for your advice, Doreen.
Sure. So, I'm always, there's two ways to approach anything that you want a child to do. You can either increase reinforcers for the whole thing, or you can shape it. So, and you can do both, obviously. So if we're just to increase reinforcers, essentially, so what you would do is you would have the child wear the bra for a very short period of time, so let's say 5 minutes, and they would, for doing that, they would get a very significant reinforcer. And gradually you would turn the 5 minutes into 6 minutes, into 10 minutes, into 20, and each time you would be reinforcing, and you'd maintain the high level of reinforcer, you'd just be increasing the duration of time required to receive the reinforcer. That's kind of one way to do it. Another way to do it is to, perhaps you would start with a one of those sports outfits that had like a shirt that has a built-in bra.
Right.
And so you would wear that. It's more like a t-shirt, but it has a built-in bra. And as the individual gets used to that, then it'll become much easier for them to acclimate to a bra. Please make sure that if it is a sensory issue, you do have a very loose-fitting, not wired bra, perhaps. There's lots of different choices these days.
She says it's a loose-fitting soft
bra. And so then all you have to do is just gradually have the individual get used to it. When
none of us want to wear bras in the beginning,
yes,
right?
And when you're
I used to take mine off when I would
Exactly.
get out of my parents' house and I'd get down the street. I'd take mine off. That was in the time where everybody was going braless. Today, there's enough violence in the world without seeing me braless. Okay.
That's hilarious. But if you think about any teenage girl, they're going to have an issue with this.
Course.
It's not comfortable.
Unless they want to be like the other girls, and our
Right.
kids sometimes don't
Right.
have that kind of social, pressure on
Absolutely.
them to conform. Okay,
Absolutely.
so hopefully that is some good advice there. Hi, Nancy and Doreen. Thank you for all your great advice. My 15-year-old high-functioning son, is great in logical skills, but his word skills vary. Some simple vocabulary he doesn't get or take literally. He doesn't like to read. How can we help him? This creates a challenge academically and socially. He is not able to understand some conversations. Many thanks.
Okay. So, this is very important, and you've identified a few characteristics about your child that he's, for instance, very good with logical skills, and you call word skills, and you're saying his simple vocabulary isn't good. And you've also identified that this is leading him to having problems academically and also socially and in conversation. And you're right. A lot of times I find that when parents want their child to improve in conversation, the number one skill that is important that's lacking is vocabulary, which is an interesting thing. We never really think about it, but the truth is many of our kids have not age-adequate vocabulary, so that's an important thing. But I would like to suggest that perhaps there are other precursor or prerequisite skills that might be missing. And so that's a very important thing. Sometimes, most of the time, what I do is I will see children that are being treated by our supervisors at CARD. And the reason I see them is because they're not progressing for one reason or another, and I'm trying to help troubleshoot.
Yeah.
So, and what ends up happening is always, much of the time, is that some prerequisite skill is absent, and no matter how much we're trying to teach a particular skill, it's not catching on because that prerequisite isn't there. And I identify what the prerequisite is. So the best way to do this is for you to, knowing that you're a parent who understands how important these various things are, wouldn't you like to know all the different areas that your child is lacking and how those are prohibiting him from learning further? So my suggestion to you, a strong suggestion, is you do 2 assessments. One assessment is the skills assessment, skills index. So I really recommend that you go on our skills website, which is right in front of Nancy, and it is
skillsforautism.com.
skillsforautism.com.
And you can also call 877-965-4559. 975-4559.
Yes, and we will help you with that. But if you just go on the Skills website and you enroll for just a month, you do the index, which is the assessment tool that starts Skills. Now, this is really important. I know your child's 15. It doesn't matter. Skills goes to a normal functioning 8-year-old, which if you're a normal functioning, typical functioning 8-year-old, you are pretty much, you've mastered most elements that have to do with things like conversation, vocabulary, etc., etc. You might have, between 8 and 15, we develop more socially, not in core content so much, and academically, of course. So what I recommend is you finish that questionnaire, you answer all the questions, and you'll have, this week, we're loading up a new assessment on Skills called the Short Index. It's a short version of the assessment. I recommend for this parent to do the long version. You'll have a choice. Please do the long version because the long version is much more detailed. It will take you a week to answer these questions, something like a total of 20 hours, maybe more. It's a lot of questions, but it will give you incredibly valuable information. What it'll do is it'll provide you a series of lessons that your child needs. So everything that you say your child cannot do, for instance, you're saying here he's not good with vocabulary. Well, we won't ask, does your child have appropriate vocabulary? We'll ask you about 30 questions about vocabulary. So it's very detailed. So we'll get a very, very clear picture of exactly what areas of vocabulary, what age level, what types of words, etc., as well as all other areas of functioning. And then you'll get each of those areas that your child is deficient on leads to and connects to a lesson or a series of lessons. And Skills will show you all that. It'll show you every lesson that you need to work on. It'll tell you exactly how to work on those lessons. It's a very good tool. It really is. So, and anyone who starts using it knows how useful it is. So I would really recommend that you do that because it will help you figure out all the different things. And it'll help you figure out how to teach those things. Like I could tell you right now how to teach vocabulary. That is not on its own going to be sufficient to increase conversational skills. I've often said here, conversation has to do with a lot of different things. Vocabulary is one of them. Being able to enter a conversation, being able to exit appropriately, being able to pay attention to other people's body language and, you know, are they losing interest? Should I change the topic? Being able to turn take, being able to repair, people start walking away. How do I repair, get them back into the conversation? There's a million things that goes on in conversation. Contextual cues, cues having to do with the audience, the person or people you were talking to, a million things. So I think the best help would be if you spent a little bit of time on Skills.
Okay. And I want to remind people that you can also, if you are a working parent and you feel you don't have the time for this, you can do it with a caregiver. You can bring in someone to learn this and work with you.
Absolutely.
Yeah. Which we have done with Wyatt and gotten that person trained and part of the entire therapy program, which is great.
Very, very important.
So we're going to take a break and we're going to come back. We've got so many questions today. We'll be back with more of Ask Dr. Doreen. This one from Paramus, New Jersey.
Sure.
Hi guys, when is a card center going to open in New Jersey?
Right.
Can you answer that?
And I wanted to say we already have opened in New Jersey in Paramus. So.
In Paramus, okay. She said she couldn't find a good ABA provider for her 5-year-old. 2 providers already were not good. He has tons of language, just still has issues with making and keeping conversation. Plus, he's not social with other people other than his 2 brothers, myself and his dad. Behavior not too bad. So though I was going to be easy to find thought it was going to be easy to find good ABA, I was wrong. He's really smart. I feel that time is being wasted. He could be doing amazing if we had the right ABA provider. He's come a long way. At 2.5 years old, he was almost nonverbal. Now he asks for anything he needs, makes comments, and when it's something into like movie credits, he can make up a whole story about it. Help, please. Well, you already said you're open.
Yeah, we're open there, and this is, again, it's kind of similar to what we were just talking about, Nancy, which is like a lot of times we expect our kids to jump from one level to another level, and a lot of times there's a lot of gaps which we don't realize. It's not the same when you can memorize 1,000 words. You're not going to become conversing with them. You're just conversational skills involve a lot more than just content, and we can definitely get him there. But the other question I have to ask, and this is pretty a sad topic, I always bring this up, or whenever I can, I bring it up for our viewers, because I'm very passionate about the effectiveness of ABA, and I feel very torn about this because, you know, over and over and over, we show that the hours of therapy are essential. The number of hours are essential. And yet, when you look at, we have roughly 2,000 children in our current database, active children. And when you look at the average, and we're an organization, Nancy, as you know, where we passionately fight for our families to get more hours of funding.
Yes.
But when you look at our children, you take a guess what the average number of hours per week is across all of our kids.
I'm going to guess across all of your kids 10 hours a week.
Yeah, it's a little bit higher. It's like 15.
Okay.
But I mean, it's really sad. It's just really sad.
And if those kids aren't getting ABA at school,
right,
and they're only getting, you know,
really,
an afternoon, maybe 2 days a week.
Exactly.
It's not enough, right?
No, it definitely is not enough. And, you know, even if it's 15, 17, 16 hours and it's like 3 hours every afternoon after school, it's just not enough. Like, we're talking about, and we've done millions of studies have been done about this, like, you know, that 15 hours just isn't enough.
Right.
So I ask this parent, you know, are you doing enough hours? Because we have these high expectations of our children, and we think that they're going to pick it up with just tutoring, 2 hours here, 4 hours there. This is not tutoring. This is a lot of skills they have to acquire in a very short period of time. And so it is essential that we give that amount to them, that those hours of high quality, good ABA. And then, of course, yes, they will succeed.
Okay. So to this mom, you're open in New Jersey, get your kiddo in there and get your kiddo on a good program. Okay. Here's a question that could take the whole show, but you're going to give a quick answer. What is autism definition and its cause?
Yes, I'd love to talk about that. But before that, there's an email from someone who says, "Dear Nancy, you are amazing. Warmest thoughts and wishes to you and Wyatt. Thank you for all you do and for your generosity. Your uplifting energy and words have been so helpful."
Thank
you. And we don't want to skip that one.
All right.
Because
well, I wanted to say this is a great opportunity for me. I learn so much when I spend time with you. And to be able to help Shannon in any way, because it would take, I'd have to write a book to say all the things she has done for me during this time in my husband's illness, the help she's given me with Wyatt.
Truly.
If I can reciprocate a fraction of what that woman has done for me, then that makes me feel good. So moving on then, autism definition and its cause.
Right, so, you know, we'll look at, and so I'll need a little bit of time on this and I'll try to be quick. You know, so autism has changed in its form, and it has also changed diagnostically over the years. The current definition of autism is on the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5. And what we're looking at now is a series of symptoms within two areas. The two areas that we consider to be reflective of autism, the first area is social deficits. Now, the difference with this definition of autism, the current DSM-5, and the prior definition, which was the DSM-4R, there are two main differences. One difference is that it became from three different types of behavioral symptoms that we look for. Now we're looking for two. In the past, we used to look for social deficits, language deficits, and the presence of what we call ritualistic, stereotypical behaviors, repetitive behaviors, self-stimulatory behaviors. Now it has turned into two, and the two are social deficits and the presence of those stereotypic repetitive behaviors. Why has the concept of language been dropped from the language deficit? Why has that been dropped from the symptoms required for autism? The reason is very simple. The reason is that the second difference. In the past, we used to have different types of autism. We would have autistic disorder, we would have PDD-NOS, we would have Asperger's, and we no longer have those. They're all now classified under the one big umbrella called autism spectrum disorders. Now, Asperger's was the highest form of autism in the past, and it was not accompanied by a language delay. So obviously, if Asperger's is now one of the ASDs, we can't any longer say that all ASDs have a language delay. However, we do say that all ASDs, all children who are diagnosed within the huge spectrum of autism spectrum disorders, will have a delay in social behavior, and there's many different forms of social behavior, and they will also have what we call stereotypic repetitive types of behaviors. Some children will also have a language delay, and that's a specifier. You can add that, so you can say ASD
Delay
with
and
language delay.
even regression. They might have language
Absolutely,
and then lose it. Okay.
absolutely. But as the specifiers go, there aren't many. So one specifier would just be a language delay.
Okay.
So you would basically, the diagnosis would be ASD with language delay. You could also have a specifier which shows intellectual delay. So IQ is low. So you could say ASD with intellectual delay. So there's specifiers that go with these, and there's severity codes now. So in other words, you could say ASD needing significant support in social skills and support in repetitive behavior. So these severity scales are very good. I like the severity scales. It's 1 to 3, 3 being the child who needs the most level of support. Wyatt right now, for instance, just for you to know, would probably be a 1 or 2 on both of these areas, because the level of support he needs is not as severe as some other children.
Right.
And that's how you diagnose it. That is really what the diagnostic manual tells us.
Okay.
Now, the question was, what is
causes it?
autism
Oh, what
and
is it?
what
Who
causes
causes
it?
it?
I just kind of gave you the standard by book definition. What is autism to me is a little bit more than just the standard kind of definition of how you diagnose it. To me, and this gets into the cause, to me, the most important thing we can say about a disorder is what causes it. I could say someone has a cold, and it's really, I'm giving zero information, because do they have a bacteria? Do they have a virus? And why is that important? The reason the cause is important is that the treatment relates to the cause. If you have a viral infection, I might give you an antiviral. Right now, everybody gets the flu, and they get Tamiflu, which is an antiviral medication. Or you might have a bacterial infection like strep throat or something else, and then I'll give you an antibiotic. It's a completely different treatment. And I think that is very important when it comes to autism. While ABA is a treatment that works with autism, period, there's other aspects to autism that are very, very important for us to know. For instance, when we look at things like children are not sleeping, right? Well, the not being able to sleep is making it harder for these children to learn.
Yeah.
So it's important to also treat the sleep issues, which they're not a direct cause, but they're definitely something that's contributing to the level of functioning.
Of course. When Wyatt goes to bed at midnight the next day, he's fussier, he has more meltdowns,
Absolutely.
and he's generally irritable.
Absolutely. Or if you look at children who have gastrointestinal issues, those children are often in pain, and we're not doing anything about it. We're just kind of behaviorally, I always, as a behaviorist, I can make these statements and say it's so important to look at all the peripheral things that are involved as well, and make those better. Now, from my perspective, just to kind of summarize how I think autism develops, I think what happens with autism, first of all, we know there's a genetic predisposition. There's a lot of families who have more than one child with autism. We've already discovered there's at least 5 or 6 genes that are common. We know that there's going to be up to 25, 30 genetic components that form sort of the ASD chart. But right now there's only a handful have been identified. But there is a genetic predisposition. Now, what is this genetic predisposition? If you have the genes that you can actually sort of come up with some of these symptoms. I believe that the first place that it interacts with the human person, with the individual, is in the redox cycle. It's in the ability to detoxify.
Okay.
The genetic component, I believe.
Is that also known as methylation?
Methylation is part of the redox cycle.
Okay.
And methylation, of course, has to do with how we methylate and how we detoxify as well. And all of the various things that have to do with detoxification, I think, play a very, very important role in the development of autism.
So then environment plays a role, because if our kids can't detoxify and they're getting toxins in their system.
That's right.
And is that, Dr. Granpeesheh, why you feel there is an epidemic? Because we do have such an explosion of toxins in the environment and in so many different forms, combined with the genetics.
Right. That's exactly right. And I feel, and genetics change over time due to environment. So it's kind of an interesting circle there happening, and I think we all see it. I don't know if you see it. I know that a lot of people I know are having health issues, chronic, mostly GI issues, autoimmune issues. A lot of women are not able to get pregnant. There's all kinds of chronic illnesses. Allergies are at a high. And these are all environmental factors. The toxins in our environment are out of control. If you look at all the toxins, I mean, I am brave enough to say that vaccines obviously are one of the toxins. They don't
can
affect.
play a role with some children.
With some children,
My son
there's
had
no
a
question.
hyperactive immune system.
There's
and
no
they did play a
question.
role.
That's right. And then there's, of course, all the pesticides in our food, the
plastics, the
use
metals,
of plastics, absolutely.
The pollution, which has been definitively tied.
That's right.
Pregnant women living near freeways are more likely to have a child with autism.
That's right. So there's a lot of different environmental studies, and when you look at them all together, you realize that the environment absolutely has an impact.
One of the best things I ever read, Discovery Magazine said, if genetics are the gun, environment is the trigger.
That's right. That's exactly right. And a lot of people will say, well, how come we're in the same environment? How come? And that is the redox cycle, right? I always, when I train my staff, I give them the example of, as young folks, you go out, everybody drinks. The next day, some people have a hangover, others don't, right? You could drink exactly the same amount of alcohol, and you will vary in how fast you detoxify. People vary. That's your redox cycle. You're born with that. That's a genetic component. And there are things you can do to improve that. There's no question. Glutathione helps that. There's a lot of vitamin B, methylation, so there's a lot of things that will help increase the redox cycle, improve it. But regardless, if you are a developing brain, if you're either a fetus or you are a young child, you are exposed to a certain number of toxins. You can either detoxify them or you get overload, period. Now, what happens if you are overloaded, and again, I use this example of kind of being hungover, it is going to affect your brain functioning. There's no question. It's going to affect your sensory input. It's going to affect how, it's like me today. I have 4 hours of sleep. I'm not straight on, I'm like trying very hard to catch up, but it's not the same. Your brain functions differently. And if you are a developing brain, a young brain, you're not observing around you, you're not learning, sounds are odd, sensory issues are off. And we know a lot of our children have sensory issues. They hear things differently, they see things differently. All of that causes anxiety. What you see with Wyatt, a lot of it is so much anxiety. All the control he tries to exhibit is about anxiety. It is.
Yeah, lessening his anxiety, ordering his world.
It's ordering his world. And so that's how I see autism. And so what we try to do, we try to remove all those environmental factors as much as possible. We try to help our kids identify the best diets for them, the healthier diets. I mean, everybody is healthier nowadays, gluten-free, casein-free, soy-free, everybody is. It's a healthier diet. If it wasn't, it wouldn't be everywhere, So, and we try to do things that will help their sleep. We try to stabilize them medically so that they can pay attention and learn. I mean, and you've seen this with Wyatt a million times.
Whole body approach.
When he's not well, he's just not able to cope with anything else.
And none of us are.
Right.
All right, well, we're going to take a quick break and we're going to come back because we have so many more questions. We
Yes.
won't get to all of them, but stay with us for more of Ask Dr. Doreen. Doreen, let's get to this question. Rather long question. I'm going to try to read through it quickly. We have a 10-year-old with ASD, never had EI, early intervention, who struggles with irritability and mood swings daily. He's been on different medications. None seem to work. We tend to send him to a quiet area to relax and calm down before the storm. Sometimes it works, while many times we're too late. My question is, how long do we need to continue sending him to the quiet area to calm his anxiety? He's getting older. We do know that changes in routines are a trigger. Sometimes we don't know why his mood changes. We have a routine schedule with PACs, with rewards. He is verbal for scheduling, but he struggles with those changes too when we need to go to the next PAC. How long do we have to keep him in routines to avoid tantrums and meltdowns? Since life does change, and we like for him to understand that. Is this our normal with him? We are so stressed. We feel we are walking backwards in age. Please, some advice.
Yeah, there's a lot there. Can I use your pen?
Yes.
I just need to itemize. There's a lot of stuff here.
Okay.
So here we go. So we know that your child has irritability and mood swings, and you've tried different medications. I don't know what they are. I don't want to comment on the medications, but sometimes they are very helpful. So it would be important to have a professional continue looking at that.
And sometimes, in fact, they can cause adverse reactions and increase irritability.
They can, only because sometimes we have. I mean, if you have the right medication, quite honestly, I'm a psychologist before I'm a behavior analyst. I'm both, and I have to tell you that there's a vast array of literature that shows that any kind of mental disability or disorder is usually treated more effectively when there's a combination of behavioral intervention and medication. Why is that? And you've identified with this child that he has some level of anxiety. Anxiety, when it hits a certain level, yes, we can behaviorally treat it, but when it's past a certain level, you need something to produce a calming effect first and then teach the individual behavioral coping skills. Sometimes our anxiety is just so out of control that we've already developed a ton of obsessive compulsive behaviors and such, and they cannot, no matter how much control you have over the individual, they're very, very hard to get a hold of and reduce, because the person is so in need of these repetitive behaviors. Medication helps take the edge off, reduces the need, and then we can teach healthier habits. It's a lot of times it's the combination that works. Now with this, so please, don't give up, because there are always good medications to keep evaluating. But what I do want to say is there's a lot of things I see here. First of all, you say that you tend to send him to a quiet area to relax and calm down before the storm. And sometimes it works, many times we're too late. Okay. So that tells me, and this is a verbal child, and you have a PECS program going which has a schedule on it. So what it tells me is that you need to teach your child how to request the quiet time himself, because it seems like you're predicting it, and sometimes you're too late. Many times you're too late. If your child had the ability to request, I need a time out from this, I need to go chill out for a minute, then he would have a sense of control over the situation. That could be a very easy thing. It could be a picture of him sitting in his quiet area, and that picture would be available to him so that he would request it, he would go get some time away from everyone. So that is something that would be very helpful, is giving him some control over when he gets to go in there. And you're saying, how long do we need to continue sending him to calm his anxiety? Now, the other more important thing here is that clearly it is not working all the time. Clearly it is not always anxiety. What you have to be very careful about with our children is that, they exhibit a behavior and then we make an assumption. We say, oh, this is because he's feeling anxious, I should let him calm down. Then you put him in there. And actually what's happening is he's getting out of a task.
Exactly. It might be rewarding the very behavior, correct?
Absolutely. Well, yes, exactly. You're teaching him tantrum whenever you want to get out of this task. So you have to be very, very cautious about making sure you're identifying the function of his behavior correctly. And if you are allowing him to get out, the task demand doesn't go away. It's still there. He needs to come finish the task. And that is something that's really important, and visually you need to be able to show that. So if he has a PECS program, which by the way, I don't know why he has a PECS program, because he's verbal. But let's assume he has a visual calendar, visual, something that shows him the events of his day. Make sure those are like little pieces that can be taken off with Velcro and put on, and work with him to establish something that has regular breaks. And so you have a series of things that are the work that is required, and you have a number of slots, okay? And then give him, let's say, 2 cards, 2 Velcro cards that show break, right? My time to chill out. And make sure you have a time frame on each of these slots. So like each slot is 15 minutes or whatever it is. Take the slots and divide them more if you need to. But so that you get all the work and the breaks, and then allow him to put the order in there. So I want to do these 3 activities, and then I want to break. Then I want to do this activity, then I want to break. And work with him to do that, because that'll be something that works better for him. Oftentimes you'll find you initially need to reduce the number of demands. You start out with more breaks and fewer demands, and you gradually reduce the breaks and you increase the demands. So you might start out with 5 to-do activities and 5 breaks, and then a week later you'll have 4 breaks and 6 activities, and so on and so forth, and you get to a point where you're actually getting everything done. But from the perspective of the child, it's very, very important that things be fair. And that, yes, you might be right, they're getting overwhelmed. These are situations when it's complicated like this where I recommend a BCBA or someone local to do a functional assessment to identify, you yourself have said sometimes it works, sometimes it doesn't work. That means his tantrums are not always due to the same reason. That means there's multiple functions. So sometimes he tantrums because maybe he's tired or anxious. Sometimes he tantrums because maybe he wants out of an activity. Sometimes he tantrums because maybe the activity is too demanding. Whatever it is, you have to identify the function for each time that he has a tantrum. That's why it's important to work with a BCBA, because those are the folks that can help you identify all the functions.
Okay.
I hope that helped.
Okay, great.
And
Next
don't give up. And I know it's very like
never
ever give up.
Give up.
I know it's very depressing, and it sometimes feels like, oh my gosh, it's getting harder, not
you're
easier.
so worn out.
You're so worn out, and your child's 10, and you're like, oh, I can't handle this. Here's what I can say about that. 20 years ago, if you had a 10-year-old, there was 0 funding and very little access. So the positive side is there's a lot more funding nowadays and a lot more access. There's so many providers of behavioral interventions. There's so many states that have coverage. Please get coverage. Get your insurance coverage in place and get a program in place. I'm a big, strong advocate for intensity, no matter what age. There's another question, I just will answer that quickly, which is behavior therapy as effective for adults with autism?
We talked about that last week, absolutely.
We often get this question, and absolutely, it's very, very effective.
Right. And I can tell you that from Wyatt, for this mom of a 10-year-old, if I take Wyatt's progress from where he was at 10 to where he is at 14, you would not believe the progress he's made. I mean, we have made enormous progress in the last 4 years, and I am of the mind that it's never going to end. And, he's 14 now. I consider the next 6 years critical. And I'm going to do everything I can right now to do the full-on push to do what we can for the next 6 to 8 years. And then there'll be challenges after that, right?
Right. And you always say, Nancy, like that you wish he had started earlier.
Yes.
Because he didn't start behavioral interventions or medical interventions until almost 5.
Medical, he was 4, started with Andrew Levinson.
And then 5 or so was therapy. But just imagine now if you hadn't done any of that, and he would be 14 now.
I think he would have. I think he was regressing, continuing to regress in some ways.
Right.
And I think I would have had a child that had. I remember, Doreen, and this is so important, I think, for families to think about. Do you remember back to a time when you would say, Shannon and I were talking about this last night on the phone. She said, I remember once having an experience they were at a friend's house, and the child came out and said to the dad, can we go play a video game together? And she remembered saying to herself, I just want to hear Jem say to his dad, can we go play a video game together? That's all I want.
Yeah.
Be careful what you wish for. I remember saying, after one of Wyatt's, Wyatt had massive tantrums. We're talking biting, kicking.
I remember the bruises on your arm.
The bruises on my arms. I used to put makeup on my arms when I'd go out, okay?
Yeah.
I remember so many times getting down on my knees and saying, God, please just take the tantrums away.
Yeah.
Please just take the tantrums away. And we don't have those kind of physical tantrums anymore. Sometimes he'll still bite himself if he gets really, really frustrated. Those went away. So we have to remember the victories. We have to remember where we've come from, and you will have more victories. And life is about challenges, right, Doreen?
That's right.
And we're going to have to just, overcome these. And you're going to have behaviors that come up, and we're going to have to tackle them one at a time.
That's right.
Try not to get discouraged, because you have to look back on the victories. And it sounds like this family has had some victories. He's verbal, and so keep going.
And that's the thing. We often, as you said, Nancy, we look at the other side. It's like, what have I not accomplished? When is this ever? Whereas really, you should just look at the fact that you've survived and your child is growing, no matter what pace. I tell my staff, it's not just about helping children recover. It's about helping families get through the struggles.
Yes.
It's about holding the family together so that you are there so they can actually accomplish this step and the next step, and no matter what it is. It could be their child's growth, it could be battling out in court with a school district IEP, it could be their insurance funding, it could be sibling issues, it could be whatever it is. We're there to try to support the family to just go to the next level.
Well,
That's
I can just
what
tell you,
is.
CARD has been, if I had not had my CARD supervisors in on my IEPs, we would not have made any of the progress we've made at school with socialization and behaviors. It's just been amazing.
Yeah, I'm glad.
So let's move to this one, because this is an important one.
Of course.
Her 10-year-old son has apraxia of speech. He is currently mainstreaming in a private school at grade 4 with a one-on-one aide. He has difficulty talking, but he can do math beyond his grade level. Great. One difficulty he is facing is sensory seeking. He is very distracted, needs frequent redirection to stop him from visual sensory fingers. I'm assuming it's something like this. Wyatt has done that in the past. He's very, is there anything that would help to reduce his visual sensory issues, fingers and touching objects?
Right. So I don't know exactly, it could be visual sensory, but then it also says touching objects. So I'm not sure if it's visual or sensory, tactile.
Right.
So it's one or the other or both. And, we have a series of replacement type behaviors. The only thing we know how to do with these types of what we call self-stimulatory behaviors is to replace them with something that is more, let's say, appropriate or acceptable, and then to allow the child to do them in specific time frames so that they kind of get it out of their system. So what you would do is you would basically allow the child to engage in very tactile behaviors. You would try to find ones that are, let's say, touching objects. You'd want to get this child, how old is he? 10 years old.
10.
You'd want to get him perhaps into building clay structures or, anything that has to do with some sort of tactile activity. It could be, baking, whatever it is that involves tactile activity, and allow that to do an hour of that every day, and then don't allow it the rest of the day. The same thing with visual. The interesting thing with visual is there are a lot of activities nowadays, because there's so many things to do on computers, that actually do help stimulate the visual needs that our children have. And if you allow them certain hours of the day and they're clear that they can go for it, they can go free during that time frame, and you tell them, hey, you're going to lose that activity, you're going to lose that reward, that time frame. If you do it outside of the time frame, the kids get it and they like hold it together, and then they do it during that free time, you know,
Okay.
where they're allowed. And that's really the way to go. Sensory self-stimulatory type stuff, sensory self-stimulatory type stuff, you can't just eliminate.
No, you
The
have to
child
find a
has
replacement
That's right.
that is more appropriate and give them time for that
Exactly.
in an appropriate way. Great. We've only got about a minute and a half, right, Kelby? I'm going to try to get to this one question. Her daughter is 12 years old. She's nonverbal, attends a school for special needs. Her teachers alternate between her AAC and a PECS board. They report that she often throws her AAC, so they mainly use PECS. She uses it to communicate preferred activities and food, but needs prompts and a lot of assistance. I'm worried she still can't communicate her wants and needs, like when she is in pain or thirsty or needs a break. Her IEP is coming up. I want her school to get serious about increasing her communication and have really specific goals for her. Any advice?
Yes. So, you know, the use of an AAC or a PECS board is very, very, very important. You can't just put it in place and then not deal with it or not use it appropriately. Teaching a child to communicate preferred activities and foods is great. She should be at the point where if she's still requiring prompts, that means that it's not being used appropriately. It hasn't been taught appropriately. In other words, she gets those things that she wants without the use of the AAC or PECS. And it's very, very important that they do this right. And of course, there's a million other things where she should be able to tell you she wants various activities, you know, how she feels, all those types of things are part of a typical PECS program. And of course, if you're using an OG device, then anything like that could be taught. I don't know your child's other areas of functioning, but I would suggest that you list all these different things that you've written here and just bring them up at the IEP. If you are able to get into a behavioral program, request an ABA program from your school. Just say, I need an ABA. Most schools nowadays have a BCBA or someone who's a behaviorist who can help establish some of this. Since you're dealing with an OG device, the person actually who would have a lot of expertise is your speech path. The speech pathologist at school should be able to give you a lot more advice on moving this up. But to be honest, and I apologize, we don't have a lot of time to give you more advice on this. We do have some programs that we've done on OG devices and on PECS. We also have some very good PowerPoints. Maybe next week I can forward them to Shannon and she can put them up for you. But what I do want to say is you need to persist. You need to continue bugging the people at the IEP and don't give up and keep calling them back and saying, this is not fast enough progress. On an IEP, they specifically will write the goals and the people responsible. Hold them to that responsibility. Keep following up. As parents, we get tired of following up with our schools, but it is their responsibility.
Yes, it is.
And this
Put
is
it back on 'em.
communication.
Right.
It's so important.
Right.